Hello everyone, our group will be discussing combined immunodeficiency. Combined immunodeficiency, or CID for short. What is combined with what? First, let me explain immunodeficiency. This is a disease in which the immune system does not work properly, resulting in more frequent, severe, and prolonged infections than normal. Immunodeficiency diseases can be classified as primary or acquired. Primary, as the name implies, is a disease in which there is already a genetic mutation at birth. It is a rare disease compared to acquired diseases. CID is included in this category. Acquired immune deficiency occurs after birth and is thought to be caused by the use of drugs or exposure to diseases such as diabetes or HIV infection. What then is combined and what is combined? First, T cells can mature to become T cells, which are responsible for cellular immunity. B cells can also become plasma cells, capable of producing antibodies and humoral immunity upon stimulation by T cells. In CID, T cells become abnormal. This prevents T cells from maturing and cellular immunity is lost. B cells cannot become plasma cells and cannot produce antibodies, so humoral immunity is lost. The loss of both types of immunity leaves the body vulnerable to all pathogens. There are 9 major examples of this disease. We will discuss X-linked severe combined immunodeficiency and ADA deficiency, which account for the largest proportion of these diseases. Next, we will introduce SCID, which is considered the most severe form of CID. X-linked severe combined immunodeficiency and ADA deficiency are also included in this category. SCID is one of the list of designated intractable diseases. Many patients are said to die within the first year of life. First, let us discuss X-linked severe combined immunodeficiency. This disease is caused by mutations in the common gamma chain of the interleukin-2 receptor. The common gamma chain is present in interleukin 2, 4, 7, 9, 15, and 21, and is responsible for intercellular signal transduction by receiving cytokines. However, when these gamma chains are mutated, they are unable to receive cytokines and thus cannot properly carry out intercellular signal transduction. Specifically, the interleukin 15 receptor has a major impact on the immune system. When this receptor does not work properly, the cells are unable to differentiate into natural killer cells. The interleukin 7 receptor and interleukin 2 receptor also fails to function properly, resulting in the inability to differentiate into T cells, which in turn prevents the transformation of B cells into plasma cells that require T cell stimulation. Thus, immunodeficiency occurs. Next, let's look at ADA deficiency. ADA is an enzyme that converts deoxyadenosine produced during cell division into harmless deoxyribonucleic. If ADA were absent, deoxyadenosine would accumulate in the cell and turn into DAMP and eventually DATP. DATP inhibits DNA synthesis and thus interferes with the proliferation of T and B cells. Thus, immunodeficiency occurs. About the symptoms. The major symptom is ease of infection. The immune system is weakened and the patient becomes vulnerable to pathogens. This can lead to pneumonia, viral infections, diarrhea, etc. If nothing is done, there is a high risk of death in infancy. Thank you for listening.